spinous process, it's more bilateral. If I do it on one spinous process, then it's unilateral, and if I do both transverse processes at the same time, then it's bilateral. So, and then we can do this from lumbar spine all the way up to cervical spine. They don't change. So what I need to do is, this is when our palpation skills come back into effect, into practice, is, let's say, Becky, it's L1, let's say T12, T1 is the spot, the facets are, actually, where is it? Right in there. Okay. All right, so that's about L2, L3. So what I'm going to do is I got to be able to palpate. There's L5, 4, 3. So it's about L2, L1. So I'm going to do the spinous process one. Is this going to move a lot when I do the MOB? Like, if I do shoulder MOB, we can get a lot of movement. I'm not going to get a lot of movement. So I got to get my finger, and I'm going to probably put one. I'm going to do thumb on thumb so that I can get a good push. It's not very comfortable for the patient, so she has to relax. All of a sudden, she went in extension, and I go, "Ooh, she's buff." All right. So it's right here, and then I'm going to just give a little push, and I can do oscillations, grade 1 and 2. If we do grade 3 and 4, I have to do a gradual push into it, because I don't want to do the quick thrust and get sued.
Are you pushing down or sideways?
I'm pushing downward. I'm pushing
on the spinous process.
On the spinous process. Now, what kind of person would this be contraindicated for? Any spondylo. Another big one would be anyone with osteoporosis, because we could break off the spinous process. Why, yeah. Oh, sorry about that, Mrs. Jones. That'll
recycle out somewhere.
Yeah, it's all right. You didn't need that one. You got 32 other ones. Make myself laugh. So that's I'm pushing down, and I want to make sure it's perpendicular to the body. And then if I want to do unilateral, I got to fall off the spinous process, and I've got to go kind of underneath the spinalis and try to find that transverse process. The muscle's going to be in the way. I'm not going to get directly on the spinous process unless they're really thin and they have no muscle. And Becky's very thin, but she has a lot of muscle, so I'm not going to really get on it. So I fall off, and I kind of try to move the spinalis out of the way, and then I can joint MOB on that side. I'm going to do the other side because that's the side that she says is bothering her. Slide off. So it could be that this is the hypermobile joint, so I should probably go one up and one down below. Let's see if I can.
So you're using both knuckles?
I'm actually using the pads of my thumb. My other hands are on there, but they're not really pushing into it, unless you feel differently. You feel like just with the thumb?
I'm not really sure what I feel. I can't tell what you're using.
Okay, well, but do you feel it on one point?
Oh, yeah.
Or do you feel like if I'm doing more all up and down? Okay, so just...
Are you doing like an ice cream scoop type of motion where you push down and push out? Or?
Yeah, to move the muscle out of the way, the spinalis out of the way, yeah. So I kind of just, I go with my thumb and then I push it down. So the reason I want to try to use my other thumb is if I'm just doing this, then my thumb starts to be deformed and crazy. So if I can double it up, it's going to be better. And then I can do both sides, bilateral. I find that spinous process again. There. And then I would have the table lower, but then I would get in here and I would push this way. The other one we want to do is the transverse mode. So that's the one I'm on the spinous process again, but instead of pushing downward, I'm pushing laterally. Okay? So the person you want to avoid doing this on is osteoporosis. Breaking off the spinous process is bad. But I can find the spinous process, I'd slide off of it, and now I can feel it, and now I can push.
Feels that.
I did it! Is that tender?
That's weird.
Oh, it's where it hurts. Well, good, that's where I'm supposed to be. You told me to get it right here. I'll get it down too. All right, so I'm not putting a ton of pressure on that. I want to be careful when you're in the clinic. They're going to ask you, do you know how to do spinal joint mode? Say, we learned it. I understand the principle, but I'm a rookie. Okay, let me show you. They'll want to show you. They like to teach. Now, the thing that we want to do at the thoracic is what's different about the shape of the thoracic vertebrae versus
Spinous
the
process, stick down to the next one.
Right. So let's say, somewhere mid T-spine. Let's say we say it's 5'6". I know that if I start up here at T1 and slide my hand, I know that the spinous process is in line with the vertebral body of the vertebrae below. And so I have to know that when I do my joint mow so that I can push on that vertebral body that I want. So I'm not really, I'm pushing on the spinous process of the vertebrae above to get to the one that I'm actually working on. Does that make sense?
Yes.
It's kind of confusing, I know. but and then I can do the same thing with the unilateral to do on the transverse process. The other thing about the thoracic spine is there is also a demifacet joint mode, but that's way above entry level. I've never done a demifacet joint mode. I've seen other PTs do it, but I've never done it.
Is that for like out of place ribs?
Yep.
Or strain.
Or strain, you're still, it's just not in the right place, and they can do a little joint mode, get it back into place. Yeah. And then the cervical spine would be just like the lumbar spine. I want to try to get her in a neutral position. Usually, I don't know where this headrest is on this bed, but if you have a headrest, just look underneath, put them on the headrest so that they're not into too much extension. Okay? So you have the spinous process, PA, they call it a PA, posterior anterior joint mode. You can do the transverse, unilateral PA because it's still posterior anterior, and then you can do the transverse mode on the spinous process. So let's try that.